New Orleans Health Innovators Challenge, or as we like to say, NOLAHI. My name is Jeanette Weiland, and I'm the Vice President of Bio, Innovation, and Special Projects at the New Orleans Business Alliance, which we lovingly refer to as NOLA-BA. And with me today is the President and CEO of NOLA-BA, Mr. Quentin L. Messer, Jr. Hello, Quentin.
Hey, Jeanette, how you doing?
I'm very well, and I'm very happy to be here in person.
This is very normal for us. We just sit and have a talk show all the
I
time.
know, yeah, this is the Q&J show. Instead of Q&A, we have Q&J. And we hope that you can see how happy and excited we are through our eyes. We are doing everything we can to stay safe in our current environment, as we hope you all are too.
Indeed. Before we begin, I want to share with you the winners of the HCA Tulane Health Systems Transition of Care Challenge, the Ochsner Lafayette General Hospital Systems Healthcare Consumer Engagement Challenge, the New Orleans Health Department and New Orleans East Hospital Diabetes Management Challenge, and Tulane University's and Ujima Economic Development's I Deserve It challenges. Those winners will be shared today, and we're very grateful for our partners for providing that type of programming.
I know, this is such a fantastic collaboration, and of course tomorrow we'll have the title challenge statement pitch competition hosted by Blue Cross Blue Shield of Louisiana and Ochsner Health. So this is a great 2 days. I'm excited for our schedule.
No, I'm very grateful.
Yeah. What before we get started with other folks, let's chat for a few minutes if you don't mind, and tell me a little bit, or please tell the audience, how did it come to be, and what does it mean to you as the president of our organization to put such an investment and such an effort into the bio, life sciences, digital health industry in New Orleans?
So great couple of questions. You always give me the hard one. So this actually began really before I arrived. Back in 2014, the board of the New Orleans Business Alliance, we're a public-private partnership with a 20-person board. A number of the board members, including Amy Quirk, who you will hear from later, sort of said one of the unique things that the Business Alliance could do for the city of New Orleans was to do bio. And then as I was hired and joined in July of 2015, the question was, so what does that mean? What does doing bio mean? And what we realized is that here in New Orleans, we have tremendous assets. We are one of only 17 U.S. cities with 2 medical schools in the city limits proper, and then you look at the Queensland Ochsner partnership, you have 3 within 15 minutes along with Tulane and LSU. We have so much brain power. You have Xavier University that has a school, not only a school of pharmacy, but is one of the best schools for training BIPOC medical doctors. You also have the VA hospital. You have a multi-billion-dollar new hospitals, whether it be University Medical Center or Ochsner Baptist or other things that Ochsner are doing. And then you also have a great provider, the largest provider in the state, Blue Cross and Blue Shield of Louisiana. So we felt that we had certain assets that we were not leveraging. So as part of doing bio, we said, hey, let's hire a dedicated professional to focus on it. And we hired Amrita Appenswamy, and then eventually you came aboard. And what you've been able to do is to take this, because what we believe is good health is not only the right thing, but it's also great business. And we realize that New Orleans has an opportunity to really be one of the nation's leader in digital health and in bioinnovation. So that's why we're doing this. We're so grateful that this has grown year over year.
Yeah, the NOLAHI program is definitely a great asset to bring marketing attention to what we have going on here. And I think it's worthy of noting that during this pandemic, now more than ever, and this is not unique to New Orleans, this is really a global kind of question, is how do you diversify your economy? How do you diversify your economy so that when things like this do happen, or when the oil prices plummet, or whatever the pandemic, so to speak, may be, how are you going to remain resilient and sustainable so that your people don't suffer? And so for anyone who's unaware, New Orleans has a very heavily dependent economy on hospitality as well as oil and gas, and so bio is such a beautiful answer to that question, because typically the jobs created really span a number of education levels, skill sets. They're sustainable. They're grounded in STEM. It's easy on the environment, so it's not something that's physically and literally polluting your place of living and working. So it's a beautiful story. And then again, you hit on another point, especially during the pandemic. People, I think, traditionally kind of think of the economy as one thing, healthcare is another thing, public health is another thing, and in reality, they're interrelated and they're intertwined, and you don't have one without the other. It's, if your people are suffering health-wise, you don't have an economy. People can't go to work. They can't take care of themselves. They can't take care of others. So it's really, I'm hoping, pushing thought leaders to think more strategically, whether you're the CEO of a top 10 bank in the world, or an oil company, or you're a small business owner, whatever it is, your people are everything, and health is everything, and it does impact the bottom line.
No, you're absolutely right. I mean, if you look at, New Orleans is a city of small businesses. And if you ask small business owners, what are some of their biggest concerns with regard to costs? It has to do with healthcare. And I think what we also realize, and this is why I'm so excited for this year's program, is that so much of the costs in healthcare and so many of the underlying conditions are treatable and manageable. And if we leverage technology, when we leverage technology, it's better stated, digital health, our phones, things that have become ubiquitous, particularly in this moment, even Zoom, with the advent of telemedicine and really the acceleration of that, we can create healthier New Orleans, which is the first thing, because you can't give back a person's health.
Mm-hmm.
And I think in a city that has such tremendous people, we have to be really thinking about how are we healthier so we can be here to enjoy it for our children and grandchildren, but also create business enterprises that can provide jobs, create wealth, and also transform the nation. The great thing about healthcare is it's one of those segments of the economy in which innovation and focusing on capitalistic growth also has a positive societal benefit.
Absolutely. And you did say the words digital health, and I feel like since we have some leaders or thought leaders present with us today, we should go ahead and get them on board and get them introduced to the audience as well. So I'd like to introduce two representatives of the two companies that helped make NOLAHI possible. We're very grateful for their participation. First, we have Amy Quirk, and she serves as the CEO of Innovation Ochsner. And we also have Daryl Langlois, the Chief Strategy Officer of Blue Cross Blue Shield of Louisiana. Hi, Amy. Thank you for joining us.
Hey, Jeanette, how you doing?
Great. I'm sorry that we're not in person, but it's nice to see your face. I hope you are healthy and well, and you look happy. So I take that as a good sign.
Everything's good, all considered, and it's good to see you and Quentin all masked up, supporting our Saints. And it's such a treat to be back here at NOLAHI.
Great. Well, thank you for joining us. Is there anything that, I don't know if you can give anything away ahead of the pitch competition tomorrow, but if you wanted to note anything about, quite frankly, the timeliness, and that was something that couldn't have been predicted. You came up with this challenge statement a year ago.
Yeah, so Jeanette, you're so right. This has been a wild ride. We came up with this statement, which is focused on social isolation a year ago. And, we thought we would be here celebrating this together back in March. And of course, everything got turned upside down. But it's a real honor to be here today with you guys on behalf of Ochsner Health. This is the third year we've participated in this challenge with the New Orleans Business Alliance team, and Quentin and Jeanette, just thank you for your leadership and everybody over there for making this happen. It's been a great partnership along with Blue Cross and Blue Shield of Louisiana to make this happen. As Jeanette shared, I'm the CEO of Innovation Ochsner, which is a part of Ochsner Health, and it's my pleasure to just get to welcome you all for here today to participate in this day. Ochsner has a long history of innovation, and of tackling some of the most pressing healthcare challenges our community faces, and some of the ones that Quentin and Jeanette were just talking about. At IO, which is what we affectionately call Innovation Ochsner, much like NOLAHI, we've been focused on using digital health, which is a new way of delivering healthcare that uses digital technology, new sources of data, to make healthcare more predictive, proactive, preventative, personalized, and ultimately participatory, and to create new access, new convenience, and ways to improve health for the communities we serve. We've been focused on digital health for chronic disease, which we all know affects so many people that we know and love in our communities. And we've seen the impact of chronic disease, but particularly in the COVID time, and how it's led to some exacerbations. So it's been a really interesting ride, seeing the last few months and seeing the value of digital, particularly as we have moved away from being in person just like we are today. But the last 9 months have truly been wild for our team. And, we all know Louisiana was an early hotspot in the pandemic. And we have a team of heroes, we call them Ochsner heroes, who rose to the challenge and cared for our community every day. And at that trying time and every day since, and they continue to go at it as we continue to fight this pandemic. And I'm so gratified to get to work alongside them and hopefully support them who work every day to keep our community healthy. Ochsner's always been committed to delivering health and wellness for our community, and that commitment's never been stronger. COVID showed that. And another reason why it's fitting today to be here is just last Friday, our CEO, Warner Thomas, announced a groundbreaking new initiative together with Governor Edwards, Mayor Cantrell was there, and many other leaders across the region and in our state, announced our 10-year vision and commitment to create a healthier state. I think this year we've put a lens on the inequity and the unequal access to critical health care that pervades our country and certainly our community, and it's a serious obstacle. And we have committed to work to help solve that over the next 10 years. The first 5 years of that strategy includes an investment of $100 million from Ochsner Health, which will focus on, in part, we're going to put about 15 community health centers all across the state and communities that need them to help eliminate barriers to care. We've opened one in New Orleans East, and you should go see it. It's beautiful. We're also collaborating with Xavier to create the Ochsner Xavier Center for Health Equity. And so there's more to come on that, and it's a bold undertaking that's going to require lots of partners from every sector to work on it. So another way it's fitting, we're here today calling on some partners from the entrepreneurial community to come forward and help us solve, through digital tools, a pressing problem that our community faces, and especially faces in the COVID-19 pandemic, the problem of social isolation. And as Jeanette and I were just talking about, it's a problem we talked about this time last year when we launched this challenge, and certainly it's become even more apparent since then. Our partner in this challenge and in so many things is Blue Cross Blue Shield of Louisiana. They share our vision and our commitment to serve and help keep the people of the states healthy. And this is the third year, as I said, that we've done NOLAHI together, and they've just been terrific partners. And just thank you to the whole Blue Cross team for all that they do. So through this initiative, it's super exciting. And tomorrow we're going to hear the pitches. And we put out a call to the national, international entrepreneurial community and said, what are your innovative ideas? And we chose some finalists from a pool of people that came from all across the country and the world. And they have the opportunity to win $36,000 in project funding, as well as some one-of-a-kind prizes that Jeanette and the team assembled, and opportunities to pilot their technology here in Louisiana. I cannot wait till tomorrow to hear the finalists' ideas and to see how we can address this really important problem of social isolation. I'm going to turn it over to my colleague and partner over at Blue Cross Blue Shield of Louisiana, Daryl Langlois, who's going to tell us a little bit more about the challenge and why we picked social isolation.
Thank you, Amy. Hello, everyone. I'm Daryl Langlois, Chief Strategy Officer for Blue Cross and Blue Shield of Louisiana. Welcome to our annual NOLAHI Challenge. This is our first virtual-only challenge, and unfortunately, I'm coming to you via video today. I would have much preferred to be live, but scheduling conflicts did not permit. But I do want to share with you some very important comments about this year's challenge. Let me start by letting you know that since 2017, Ochsner and Blue Cross, a payer and a provider, have chosen to partner and co-sponsor this annual challenge. We believe that bringing healthcare innovation to New Orleans, as well as the state of Louisiana, is the right thing to do to provide for a better healthcare system in Louisiana. In the fall of 2019, we gathered in a small room on the Ochsner campus to discuss what would be the appropriate topic for this year's challenge. Dr. Richard Milani quickly suggested social isolation. We knew that the elderly population and others who were disadvantaged were suffering negative health outcomes due to this phenomena. If you think about it, social isolation is when an individual doesn't have the opportunity, doesn't have the ability to take advantage of a social support system, a system that would enable them to make easy the everyday tasks, to access healthcare in a way that is promoting better health for them and connecting with others in a meaningful way. We knew this would be a problem, and therefore we chose that as our challenge for this year. But even as we sat there in 2019, we could not have imagined that COVID-19 was coming around the corner and that it would multiply exponentially the impacts of social isolation. When you consider stay-at-home orders, when you consider quarantines, when you consider social distancing, the effects of social isolation grew beyond the populations we originally considered, which is why this challenge this year is so important. The opportunity to have lasting effects, lasting impacts in a positive way on healthcare in Louisiana is just significant. And we so much look forward to the forms of innovation that we will learn at the challenge this year. In closing, I would like to thank Ochsner for continued support and being a great partner in bringing innovation to Louisiana. Second, I'd like to thank the New Orleans Business Alliance and Quentin Messer and his organization in helping organize and provide for this great opportunity. But most importantly, I want to thank each of you who have chosen to participate today, because it is through your ideas, your participation, and your engagement that we will make a difference, particularly in this space of social isolation. At Blue Cross, our mission is to improve the health and lives of Louisianians. We know we can't do that alone, and that's why we think about these events every day as an opportunity to provide for that. So enjoy the presentations, and most of all, thank you.
It's inspiring what's happening here. New Orleans is the city that brought health equity into focus for the nation. So I don't think there's an employee in our company that isn't inspired to come down here and want to support the innovative efforts that are happening and the changes that are occurring.
New Orleans is a great place and actually startup friendly. So we were looking for an opportunity to come here to connect with the healthcare organizations here to provide our platform and work with them.
It's not all great ideas are going to come from traditional delivery systems or even payers. We need the assistance of bright thinkers and entrepreneurs out in the community.
It's just a great experience to get out there and show what you're doing and get feedback. I mean, that's what you have to do as an entrepreneur. You can't sit in, in a in a co-working space and try and solve a problem. You have to be out meeting with partners and hearing their feedback, positive and negative, and that's what makes your product better and your company better.
It's always great to have external feedback, participate with other entrepreneurs, get their feedback on how to start an idea, start a company, take it to market, get it to post revenue.
It's important for us to have a platform that we can get the funding that we need to take something from a concept to a final device and introduce it to the world to make a positive change.
The solutions that we think are going to move forward, not only our strategy, but the ability for healthcare to be delivered to our customers in a better way, is going to come from those who are thinking forward about ideas.
This is an opportunity to showcase your expertise, your team, your ability to solve problems that have been identified. And I think it's a great opportunity to learn how to work with these big organizations that are opening their doors and practically inviting you to come and join.
Thank you so much, Daryl and Amy, tremendous partners. I now have the tremendous pleasure and honor of introducing today's keynote presenter. A great man said, "We build bridges to redefine what's possible to create a better tomorrow for all populations." That great man was Cornelius Bankston. You'll be hearing from him later, but let me just tell you a little bit about him. He's a Morehouse man, like our soon-to-be former Congressman Cedric Richmond. He is, I call him Mr. Atlanta, because not only did he get one degree in the city of Atlanta, but in addition to Morehouse, he has degrees from Emory and Georgia Tech. He's inspiring. If you look at their website at Tech Plug, tremendous story. He's also the curator of Beyond the Divide NOLA, which is a tremendous program to talk about how healthcare can be brought to populations that are traditionally not there. Today, Cornelius will have a presentation on the urgency of now, creating equitable health tools. Before I begin and introduce him, I will encourage you to use Slido. It's on your screen. Please put your questions for Cornelius in the Q&A tab of Slido. And now, I present to you Cornelius Bankston, Managing Director for Tech Plug. Cornelius.
Quentin, thank you so much. Good afternoon, everyone. It's such a pleasure to be here with you all virtually. It would have been great to be there in person, but due to the times in which we're living in, it's not possible. But it's great to see you all are masked up there in New Orleans. So let me just go ahead and jump into this. So thank you all again so much for the opportunity. I'm so very excited about this topic, the urgency of now creating equitable health tools. Also, I'd like to congratulate all of the participants in this challenge, as well as the sponsors. So let's jump into this. So let me tell you all, my love for New Orleans runs really, really deep. I enjoy the food. I enjoy the culture. I enjoy the music. It is an amazing place. However, the only time I have an issue with New Orleans is when my Atlanta Falcons play your Saints, and we have a game coming this weekend. So I just had to put this in here to say my love runs deep, but go Falcons for the upcoming game. But to continue on the theme of my love of New Orleans outside of the Falcons-Saints game, I also want to talk about, I used to spend a lot of time coming to New Orleans for a lot of work conferences, but not until around 2017 did I have an opportunity to see New Orleans through a different lens. And I was there for the first time for the Essence Music Festival. And I was out on the run going to a Walmart, and I go into the Walmart and I'm looking for some things to take back to the Airbnb. And then I walk down an aisle and I see a jar of pig feet. And I'm like, why in the world is there a jar of pig feet in this Walmart. Took a step back, put on my business school hat and said, supply and demand, right? So individuals in this community like pig feet. But then it was kind of disconcerting as it relates to, the health challenges that are associated with consuming too much of that. But then the idea and the thought around localization began to play out in my mind. So let's put a pin there and we'll revisit that throughout this presentation. But localization, what is it? Why is it so important? I'll take you all another little journey. I like to tell stories to help people to understand why this work is so important. So I'll take you back to when I was a child. I experienced loss at a very early age. I had a cousin who died from complications of sickle cell anemia. And sickle cell anemia impacts over 100,000 Americans, particularly African American and Hispanic Americans. And to this day, as I close my eyes, the image that I see is her mother standing at the top of the stairs to their apartment, dressed in black. And the only thing that I have no words to express the expression on her face. And to this day, there isn't a cure. There's treatments, but there isn't a cure. And even today, I wonder, why isn't there a cure? Fast forward a few more years, I'm flipping through a Campbell biology book in my advanced placement biology class. It's a big, thick book. And I'm flipping, and then I come across this face, this brother's face. I'm like, wow, who is this man? He is Dr. David Satcher. And at that time, he was the director of the Center for Disease Control and Prevention. I became completely infatuated with him. He went to Morehouse and got a chemistry degree, got an MD, PhD from Carnegie Mellon. And as we all know, he became a US Surgeon General. But the thought is, what is the CDC? What is the Center for Disease Control and Prevention that's headquartered in Atlanta? That thought just began to resonate in my mind a little bit more as well. CDC, what is their mission? Their mission is to get individuals access to innovative or to prevent pandemics, right? That is their whole mission, and get people life-saving therapeutics so we would not some of the things that we're experiencing today. And so fast forward to where we sit today, we are interacting via telecommunications because of this virus, the novel coronavirus that has impacted our world in a tremendous way. I thought from where I sit, it was back in, I think, February. I was like, wow, that's amazing that it's happening in China. That could never happen to us. We will be okay in the US because we have the CDC that's on top of this, and it will not happen to that big effect that I thought. But then to my surprise, it hit us in a major way, and we've all experienced some form of impact from this coronavirus pandemic. Hence the way that we're engaging now through this telecommunication tool. CDC, why aren't there cures? All these things start grappling my mind. And so when I think about the urgency of now, I think about the coronavirus. I think about this number, 10,846,373 people have been impacted by this virus. And that's a huge number. And sometimes we get kind of isolated within our silos, and I think I do sometimes, as it relates to my daily work, right? I churn to try to, figure out how I can increase health access to the least of them. But this number is so stark, and sometimes we can normalize this number and get detached from what this number represents. This number represents the countless faces that has been impacted by this disease. And so when I think about the urgency of now in creating equitable health tools, I think about the people on this screen, the names I will never know, the lives that have been lost, and the importance of creating equitable health tools. So when we think about the coronavirus and we think about now, what has this done for us? For those of us that probably don't live on the other side of the railroad tracks, as my grandma would say, that it has exposed systemic racism in healthcare. It has exposed and elevated the conversation around health disparities within populations of color, and not just populations of color. When I was in New Orleans, maybe a year and a half ago, I was on Xavier's campus at a public health class, and they were talking about some of the work they were doing there in the community. And there was a term I had never heard before, and it was a term called food swamp. And I've heard of food deserts, but I had never heard of a food swamp. And the students went on to explain that there is absolutely no healthy food options within miles in that community. This virus has elevated that conversation here today. These individuals have countless stories. And so the urgency now is, how do we develop effective tools to meet them where they are? And so let's go back to that term, localization. When I was in the Walmart, I saw pig feet. How do we take that term, localization, and apply it here to the countless names that have been impacted by this disease and others? So we want to localize the innovation to meet people where they are. And how do you do that? And how do you think through it? So I have a slide that I'm going to share with you how I think about equitable health tools and how I've been able to navigate my career around elevating this conversation and hopefully inspiring entrepreneurs to think about this in a different way. And then two, the payers and providers. So in my mind, I kind of think, I'm a Black man, so I sometimes think about, people that like my grandmother's age that might live in a rural community during this time, during this pandemic, like this woman in this photo. In my mind, what are her challenges, right? What are the things that she's experiencing that she can't get the adequate health care? So she might live in a food swamp if she's in a rural area, or she might live in a metropolitan area where she's afraid to get on the bus to get to her doctor's appointment. And on top of that, she doesn't have Wi-Fi access. So let's pause and just think about that for a moment as we sit here and think about how do we develop these innovative tools, but the spectrum of individuals on that, how they're impacted. Some people don't understand tech, some people do. Some people are afraid to get on buses, some people aren't. There's a whole host of opportunities here. I do a lot of work in Silicon Valley with a lot of startups in the Valley. And if you look at this, this is a real team in Silicon Valley. It's the Freenome team, and they're doing some amazing work. The science and innovation is amazing. But when you look at the team and you look at the woman in the picture, for me, there's a disconnect. If you're developing a tool and you don't have people that might have that experience at the table, to me, therein lies a problem. Because I believe in this day and age, healthcare acts, innovative health solution, everyone should have access to it. So how do we think about creating equitable health tools if our innovation teams are looking like this? One is, we say there's a K through 12 opportunity in STEM, but we're living in this moment and we got to accelerate where we are. So how do we get these teams access and engage with individuals like this lady on this photo? That's where all of you on this, where you all sit will come into play. You might be a provider, you might be a payer, you might be a hospitalist. And I know that your schedules are full and you're combating COVID on a whole list of other things, trying to figure out how do you get remote patient monitoring, coupled with your Epic systems. And there's a whole slew of things that are going on. But we're living in a moment where we needed innovative health solutions for this time 9 months ago. And how do we, where we sit, get these innovations to the individuals that need it most? And I would encourage you all in your time that if you have any free time, look at these types of companies, seeing how you can interculate yourself and your knowledge into that space. One thing I like about New Orleans is this little side note, some dear friends of mine there in the New Orleans Department of Health, Dr. Vegno and Chantel, great friends of mine, and been able to help with a lot of important work that we've been able to accomplish, is they understand, the importance of engaging with innovative health companies. And so I encourage you all to if there's an opportunity for you to think through that, because what they need is the data, but also like the Department of Health there in New Orleans, and they told me this plenty of times to the Cornelius, we don't want companies to come into our community to take advantage of our population. And I think that is how you should lead, right? Lead with, let's protect the population. Let's ensure they get the innovative solutions they need. So that's one of my challenges to everyone on this call that might have some play as it relates to innovation is, how do you actively engage with these types of companies so that we can get equitable health tools to those that need it most, localizing the innovation to meet the people. And so in my last few minutes of conversation here, I wanted to elevate some things that I was able to see in this report that Dr. Vegno and Chantel actually released, I think last year, around the healthiness of your city. And these three areas kind of really popped out to me: heart disease, sexually transmitted infections, and maternal mortality. That last one, maternal mortality, for the state of Louisiana, I looked at some health data recently. Louisiana is #1 as it relates to maternal mortality in 2020. And so when you start, and then when you break that data down and you start looking at women of color, and then break that down into people in rural and urban settings, and you just see the data and how people are dying because, one, they might not have access to the innovative health solutions. So how do we close that gap? How do we get those types of companies that we're seeing in Silicon Valley and across the world, in Atlanta, New York, London, et cetera, engage in a way in which they can understand the challenges at the local level, at the patient level? How do you create those experiences? Because if you have a technology that is robust enough to not only speak to someone with insurance, and to those that don't have insurance, you'll be a profitable company. However, you're providing access to everyone across that spectrum. Give you some insights into a few of these companies that are doing some amazing work that I think that addresses some of those disease areas. Bodyport in San Francisco. I think they partner with Ochsner. So Ochsner, I also know, is doing some amazing work. Let me just shout out Ochsner quickly. In my time at Color Genomics in Burlingame, California, Ochsner was one of the early hospital systems that engaged with us to do population genomics. So thank you, Ochsner, for being a leader as it relates to innovation. Bloom Life is a remote patient monitoring platform geared towards maternal health. As you look, it is an amazing platform. Simple Health Kit, they're addressing sexual transmitted infections in women, where one can get diagnosed within 10 minutes while they're there in their doctor's visits. So if you think about populations that don't have insurance, they typically get tested, leave, and there's no way sometimes to get in contact with those individuals. However, with this technology, they can get treated there on the spot. They know for certain if they do or do not have those sexual transmitted infections, gonorrhea, trichomoniasis, and chlamydia. I know I've said a lot. I would have loved to have been there in person to engage you all more in this conversation. But I want to take us back to where we started in this conversation. We started around sickle cell anemia, how today there still isn't a cure. And I think through a lot of different lenses. I think through, like, well, Cornelius, you're a chemist. You should have been able to, go and, more people that look like me should go and try to combat it because it impacts my community specifically. And then I think, well, you can go out and be a person that can just shout from the mountaintops and say, this is an issue and we need a cure. Or you could have went to medical school and treated people and kids around sickle cell anemia. There's so many opportunities that I could have checked in order to help create a cure. But what this has done for me, it has created empathy. It has created empathy in a way in which I sit down daily to do the work that I do and not just think about the tasks that I have, but the end user, who's the patient, and what's their struggle, and what's their story, and how can I make their lives a little bit easier through my knowledge and my know-how? How do I help create equitable health tools so that their lives can be easier? That's me getting out of my experience, getting out of my desk, outside of my place where I live, sometimes physically putting myself in those environments, but also speaking with them and engaging in a very authentic way. I feel that's the only way in which we're going to get true equitable health tools, especially in this moment where we have a pandemic and we're probably about to go, the country might shut down again as we're looking at the cases that are spiking across the country. So in closing, I just want to hope and express to you my gratitude for this opportunity to speak with you and share my thoughts around the urgency of now in creating equitable health tools and continue to do the great work that you're doing. I'm Cornelius Bankston. Thank you so much for your time today.
Thank you for being here with us, Cornelius, and I hope you're still there because Quentin and I wanted to chat with you a bit. Your talk is extremely important, and all the points that you make are very, very relevant to today more than ever. And quite frankly, I hope in our lifetime that TechPlug is put out of business. That would be a fantastic goal. I don't know if you can see Quentin and I, but we came in hot because we knew you had your strong Atlanta connections. So we did not plan this, but we both had the same thought in mind. We are representing.
Yeah, and I just want to say,
I see that. Can you hear me?
Yeah, I can hear you, Cornelius, and I just wanted to say you're a man of numbers, and I just wanted to remind you of a set of numbers, 28 and 3. So I know that has.
No, you see, oh, that hurt, Quentin. You didn't have to go that deep. You didn't have to cut that deep, man.
But no, you.
Oh wow.
That was incredibly powerful, and I tell you. Yeah, I'm probably never going to look at a jar of pig feet in the same way with so much affection. But no, on a serious note, congratulations on all the success and a great presentation. I want to drill down a little bit, if I may, and now I'll turn it back over to Jeanette, just on the question of localization and connecting that to protecting the population. As you work with companies both owned by BIPOC entrepreneurs like yourself, and then those that are owned by, white men or white women, how do you discuss that? I mean, as you're trying to help companies think about getting to profitability and getting to, the next stage in their strategic growth, how do you balance that, and how are you able to sort of articulate the connectiveness between localization, protecting the population, and also building a great business?
Oh wow, that's a great question. Thank you for that. It's it's a very real conversation to have, right? And so I'm very direct. I lead with, I usually try to pull up CDC data, depending on what disease area they're focused on. So say for instance, they're focused on, heart disease, and it's a white male that's leading the charge for that company. I help them to understand where that is mostly impacted. And one would see it's along the southeastern states. And then I correlate that with their innovation so they can understand that, coupled with the numbers and where they will actually have greater impact. And then that shows them like, wow, not only can we make dollars, and some people are like looking at the dollars and the revenue, and hopefully I can help turn their perspective and start thinking about impact. But then they see like, wow, we were only focusing on these tier 1 research institutions, which is nothing wrong with that. There's nothing wrong with working with the Stanfords and the Columbias of the world. But then they see the opportunity to work with the Xaviers of the world and the Tulanes and the LSUs of the world, because they see that there's a huge unmet need there. And so I lead with those types of data points. And then we get into the conversation around people of color and the disparities that exist and how their technology could be rate limiting care that they need. And so I lead with CDC data, couple it with impact, and then how their business could be a solution into that.
That's wonderful. I go back to when you and I first met, and that was at Essence and on Xavier's campus when you had your Beyond the Divide program in the summer of 2019, I think it was. It seems like so long ago, but it wasn't that long ago. And I remember you describing what TechPlug aims to accomplish and how, and you've already summed this up, so I don't mean to repeat what you already said, but how basically the people making investment decisions, the venture capitalists who are considering investing in these startups, who are trying to come up with solutions to help all sorts of different, population subsets, are disconnected, like you just illustrated. So my question is, are you seeing, since you still work in Silicon Valley and you go back to, and you work with groups there actively, are you seeing any change in who's brought into the room at the table when these investment decisions are made, or is this still like this problem that we're just going to have for a long time, and you're just got to keep beating your drum about?
Yeah, great question. I think because of the current climate as it relates to addressing systemic racism, it's elevated these VCs, their consciousness, right? Because we see SoftBank with a $100 million fund. We see a lot of efforts going into tech access, but what we're not seeing is are individuals engaged on the health tech space. There's a huge disconnect there. I'm working currently with a founder, and her VCs are basically all tech individuals. So they don't understand the challenges that it faced in order to get a clinical study moving, and the challenges to recruit patients, right? So in my experience, even today, there's still a huge disconnect. There's still opportunity within the ecosystem for other hospital systems, payers, to become more actively engaged in this conversation, because we're not seeing it in Silicon Valley. I have a good friend who developed a technology that you all are all very familiar with if you have an iPhone. Said that, you know, in Silicon Valley, they just live in a bubble, and they create everything based on what they need or what they see, right? And they really haven't pierced the bubble, and it's compounded in health. Not, and we just talk about tech is one thing, but when we talk about health tech, we're not seeing it. I think there's so much opportunity there for systems, payers, VCs to get more actively engaged.
Gosh, that is so surprising. I mean, I'm not going to date myself. I'm not going to tell you how many years ago I was in business school, but I mean, even many years ago, I mean, corporate America is well aware that more diverse teams equal, you know, higher profitability, higher revenue. It's just shocking. I have another question. Unless you had one too.
Please go ahead.
Well, let me just say this.
Okay. Yes, please.
Yeah, there's one point when you was mentioning about there's a fear factor. Individuals, if you don't know something, like I was recently in a neighborhood that most people were not driving to, but I want to go talk to someone who was impacted by diabetes, something that, you know, my family's been impacted by, but I went into the neighborhood, right? Because I wasn't afraid to go there. So if we think about it from that perspective, when people don't know about the struggle, that goes back to the whole empathy piece. You have to take yourself outside of yourself in order to understand the struggle of someone else. And if you're unwilling to do that, we're still going to stay in our silos.
Yep, that makes perfect sense. The other question that came to mind when you were speaking earlier on, and I forget which day of the week it was, but we just hosted the MedCity Invest Population Health Conference, and we listened to that fantastic talk with Conrad Kelly from Merck's Social Determinants of Health Division, as well as a local MD/CEO/Wonder Woman of New Orleans, Dr. Takesha Davis. She's the CEO of New Orleans East Hospital. So they had a great dialogue. It was extraordinarily candid. It was fantastic, and they touched on what you touched on earlier in terms of food swamps. I hadn't heard that term. But something that they said that I thought was noteworthy was they kind of mentioned that, you know, we just have to be careful as people who are coming to the table with solutions and technologies and answers, if you will, or with all good intentions, that just because you build a grocery store with fresh food doesn't mean it's going to be utilized in the way that you're hoping. And so I was just curious to know, have you seen any tech applications or technological answers to kind of that educating factor, but in a way that people can actually engage in it? I mean, people, for the most part, we're worried about putting a roof over our heads and feeding our families and staying employed and don't even get me started about COVID. But so have you seen any interesting solutions to that dilemma?
Honestly, I have not, to be honest with you. I think that approach goes back to the concept around touching people where they are to get them engaged. That goes back to that grassroots effort we saw in our most recent election cycle, right? People going out knocking on doors. I think that technology is amazing, and that's how I make my living, by engaging in technology. But I think we cannot take out the human component of the human experience, and that's connecting with people in an authentic way. And I think tech is great to do that, but I think we have to figure out a way to keep the authenticity of the human connectedness. And that is knocking on the door. Even in this COVID time, we can't even do that. It's probably picking up the phone to engage with them in a more authentic way. But to answer your question, I haven't seen anything like that come across my computer screen or in my inbox. But I think that is something that is needed. That's a challenge that we see in the clinical trials, right? Recruiting and getting people educated in order to participate in these clinical trials, especially now with COVID.
Wonderful. Quentin, did you have another question?
I have one last question, if I may.
Please do.
Sure. So, Cornelius is a wonderful human being, although he's got a misguided football fandom. But hopefully we'll cure him of that. But you mentioned about your love for New Orleans. As an economic developer, I have to ask, we know you love New Orleans. We know that we could figure out ways for you to grow and thrive your business here. What would it take for Cornelius Bankston to have a second office for Tech Plug here in New Orleans? And I'm asking not only specifically for Tech Plug, but just for other comparable organizations. What do we need to have here in New Orleans to get you to pull the trigger?
Oh, that's a great question. I think you all have the pieces, and I think you have the institutions that are engaged. So NOLAHI is a great convening of those entities. I mentioned earlier, from where I sit, we really try to pull the innovative community from around the country to populations that need it most. So engagement with systems like Ochsner, engagement with people like Dr. Jennifer Avekno, engagement with the business community like Jeanette, being able to have them to sit at the table and not to say, because this innovation came through Cornelius, we're going to adopt it, but to be able to convene those individuals, in a quarterly fashion. So when those opportunities present themselves, I can go to the right person. So I'm gonna put on my economic development hat right quick, because I did economic development for a few years. My whole thought around this one is really around, if a person like myself or someone in the Valley decide to put a location there, I like that Google model where they went onto Howard's campus and they were able to educate the students there at Howard, but they developed a pipeline for students to then go to work at Google out in California. That's the whole thought that I kind of lead with as well. Why not have an innovation center like at Xavier that can partner with Dr. Sarpong there and his efforts around health disparities? And then you're pulling in, my connectivity from Apple and Facebook, et cetera, to sit there in New Orleans to create solutions in real time. I think you all have all the pieces. I think it's just, being able to formalize it a bit more. And I'll pop up a shop somewhere close to Xavier, between Xavier and Tulane, to do that work. Yeah, great question. But that's kind of, what I would lead with. And I think you all have all the pieces. It's just pulling the trigger on it.
Thank you so much, Cornelius. You were a very, very valuable contribution to today, and we could probably go on and on and on and keep talking to you, but we do need to move on. So thanks again, and hopefully we will engage with you again soon. In person would be preferable.
Yeah, in person. All right.
Yes. All right, ladies and gentlemen, up next, I want to introduce one of my close colleagues, the Vice President of Industry Attraction and Retention at NOLAHI, Mr. Louis David. Thank you for sticking with us. We have a really fantastic panel coming up. Like I said, I'm joined right now by my colleague, Mr. Louis David. He serves as the Vice President of Industry Attraction and Retention at NOLAHI, and he's going to go ahead and lead a panel discussion with the winners of 4 of the 2020 NOLAHI Challenge Statements. Welcome, Louis.
Jeanette, thank you so much for getting everything together this year. Wow, we're virtual. What a difference.
Yes, this is different.
It looks great. I'm excited to see so many of the companies are, responding to COVID, and we'll talk to some of the winners about what's changed in their world. But it's always awesome to see Cornelius Bankson, and I'm excited for the winners tomorrow.
I know, yeah, the pitch competition is going to be really fun, so definitely tune in tomorrow for that. And the thing that I love about your section coming up is that each of the 4 challenge statements that they're going to review are different. And so this is not a very mundane, single theme panel discussion. You're going to see 4 distinct different companies. And I don't know about you, Louis, but I just always am inspired by entrepreneurs who can take that risk and go out and start companies. I mean, I just think it's amazing and always impressive. And then, of course, in the healthcare space, they're doing it for the greater good, and they're trying to make an impact on people's lives. I just think it's fantastic.
Yeah, and obviously, we're going to need a lot of innovation to get us through the next few years, especially in healthcare. So I love to see NOLAHI change and evolve with what's needed. It was always built around what the healthcare needs are. Exactly. So it's really cool to see us continue to change.
Yes, definitely.
So thanks for shepherding that this year.
Oh my goodness, my pleasure. And of course, we can't do it without our entire team. So
definitely.
Yeah, I'll leave it to you to introduce.
All right, thank you, Jeanette. So we've got some exciting winners who have already been announced. I'm going to move this up right here. Some winners who've already been announced for a number of the challenges. So hello, everybody. Welcome to our show this afternoon. I'll introduce everybody real quickly. So the HCA Tulane Healthcare Transition of Care Challenge was won by Dina. And Tim Coulter is the COO of Dina, and he joins us in the top left. Welcome, Tim. Ochsner Lafayette General's Healthcare Consumer Engagement Challenge was won this year by Predict Health. And Shub Debgupta is here as the CEO from Predict Health. Welcome. Great. New Orleans Health Department had teamed up with the New Orleans East Hospital. This is their second year teaming up for a challenge. And this year, their challenge was the Diabetes Management Challenge. That was won by PAC Health. And Maisie Razalina has joined us from PAC Health. Welcome. And last but not least, in our final Hollywood Square, Eric Meyer joins us from EDP Biotech. Tulane University teamed up with Ujima Economic Development this year for their challenge, and that's the I Deserve It Challenge. So welcome, everybody. Welcome virtually to New Orleans. We're glad to see you, and the production looks great. So I just want to dive in, and first off, I mean, I want to know, why does your company fit your challenge? And since we're going from the top, I'll start with you, Tim.
Yeah, no problem. Thanks for having us here. This is really cool. I like being part of this virtual panel. So at the same time, I would much rather be in New Orleans with everybody. I think that'd be a lot more fun. I definitely one of my favorite cities. So I definitely missing that. I think for our challenge, so like you mentioned, we won the Transitions of Care Challenge. And at Dina, what we're really dedicated to doing is making sure that people have the resources to age at home. There's the rising senior population. We have a lot of different folks in our side of our company who have had to care for aging parents, have had to care for folks that are homebound. And so what we really wanted to do was create a technology platform that allowed people to seamlessly transition from one healthcare setting to the home. So whether that was from a skilled nursing facility or from a hospital, we just wanted to make sure that there was a way to do that in a way that felt natural, a way that felt normal, and also was data-driven. And so we partner with health systems, with health plans, with large home health and small home care providers and skilled nursing, and everybody on that care continuum to really make sure that transition of care is seamless and is done with a lot of compassion, and to make sure that people end up in the right place where they can get the right care.
Awesome. Well, congratulations. We're excited you participated this year. I'll go next to Shub. Shub, what makes Predict Health a good fit for your challenge? Hey, Shub.
Hey, how are you?
There we go. What makes welcome? What makes Predict Health a good fit for your challenge?
Predict Health, what we focus on is really access to care. So really recognizing that even though even if there's so much innovation going on in healthcare, you can have the best programs, you can have the best drugs, you can have the best vaccines, but if you can't get people to use them, or you can't get to the people to at the right time, you're really a lot of it will fail and you're dead in the water. So how do we beat health? Is we focus on using AI and advanced analytics tools and very unique data to really understand the individual and be able to deliver access to folks, to be able to reach them, identify who needs the healthcare, engage them, reach them, and then deliver the actions. It could be sign up for a plan, maintain a plan, or renew a plan, or engage with the specific activity needed for a program to be successful. So what we do is really understand the individual at a whole person level, and we have that across every identified individual in the more challenging, more vulnerable markets. So it could be in senior care and Medicare, as well as in Medicaid, and we work with health plans and risk-bearing organizations.
Awesome. Well, it does sound like a really good fit with the Healthcare Consumer Engagement Challenge. We're excited that you guys have been successful, and we look forward to seeing your success moving forward. Maisie, tell us a little bit about Pack Health and how you fit with your challenge.
Yeah, absolutely. Hi, everyone. Again, also, we wish we were in New Orleans. We're right up the road from you, Birmingham, Alabama. Yeah, what makes us unique in the Diabetes Challenge, as many know, many members living with type 2 diabetes often have other chronic conditions. And so what our platform as a patient engagement platform does is work across 30 different chronic conditions. And we've approached this in a very empathetic way. So at Pack Health, you receive your own dedicated health advisor. That person is throughout your engagement, so it's not a call center approach. We've removed all the technology barriers so that you can text, make phone calls, do email, receive personalized information and services. And then we've made some integrations with last mile services so we can deliver food, prescriptions, a whole variety of different technologies as well through remote patient monitoring. And our approach has been to make coaching a standard of care as part of the healthcare system. So let nurses, pharmacists, doctors do what they do well, and let us work with members in between visits.
Awesome. Well, thank you again for participating this year. And Eric, the I Deserve It Challenge may be one of the most unique ones that we've done through the NOLAHI experience. So tell us a little bit about how EDP fits into that.
Well, thanks for having us, and we're very honored and proud to have won this I Deserve It Challenge. It really does fit in with the mission of EDP Biotech. We are a small diagnostics company, and we're really focused on delivering cost-effective and simple diagnostic tools in a decentralized way to get this into communities where there may already be lacking some access to that healthcare. Because as we all know, especially in oncology, early detection is the way to essentially improve patient outcomes and really treat those patients at the earliest onset of any of these diseases. And so we believe that this really fits in with what we are doing at EDP Biotech related to cancer liquid biopsy, getting much more cost-effective tests from a simple blood draw out into the hands of physicians so that they can treat their patients as quickly as possible.
Cool. Lots of flexibility these days in all of those worlds. And I believe all of the companies here have shown great innovation. So let's take a look at a quick video from Dina explaining a little bit more about their company. Awesome video there from Dina. The next question to our panel of NOLAHI winners. What's interesting about doing business in New Orleans, or having New Orleans as a place where you're, investing, learning, researching, because that's why we're here for NOLAHI. So I'm going to go backwards. I'll start with you, Eric, with EDP. What do you think?
Sure. So for us, it's the ability to get into what are potentially thought of as underserved communities and really deliver the tools that are needed in these communities in a cost-effective way. We are located currently in Knoxville, Tennessee, which is surrounded by some rural Appalachia region, and we know that these are the types of populations that have higher incidence of colorectal and other cancers, which is really our aim to diagnose early those types of carcinomas and precancerous lesions. And I think that in addition, being able to spread out the geography throughout the Southeast is very attractive to small startup and entrepreneurial ventures like ours.
Interesting. Yeah, it is. We have kind of similar profiles in New Orleans to some other cities in the Southeast. So it makes you think, if you can test something here, it may be able to work in a lot of other places. Maisie, you guys are right up the road in Birmingham, not too far away. What was attractive about New Orleans to you?
Yeah, I mean, we jokingly say if we can support Alabama, I think we can support other states around the country. So for us, it's the same. We understand the population, we understand the disparities in care, the challenges and barriers that a lot of these members face, especially in the Southeast. But I think in New Orleans, there's also a concentration and density of great healthcare. And so if we can be part of that solution, from Birmingham to New Orleans, that's a great feather in our cap.
Awesome. Shub, tell us a little bit how Predict Health and New Orleans can kind of grow together, and how do you see that relationship working?
Right. As Maisie was pointing out, New Orleans is actually quite a unique city, which has tremendous healthcare and healthcare facilities, but also has this huge gap in access for individuals. And really understanding how do you make that link or bridge that gap. It's not that people don't know that they have where the healthcare is available. It's really certain things about their lives or their situation really are barriers. And so how do you identify those? And this is where Predict comes in, to be able to identify those gaps and be able to create, and if you can identify it at the individual level, you can create programs specifically to help them address those. And that's where we see the opportunity for growth, really being able to bridge these two sides. It's really creating the market, closing the market and closing the loop, so to speak, so you're able to access the care that's available to you, and as well as understanding the affordability. There's a large number of government programs, federal, state, that are available for individuals who may have financial difficulty or affordability issues. Being able to, and a lot of that is available but not known. There can be another barrier. It can be identify the three parties, be able to bring patients to the healthcare system and create an affordable system. That's what data technology can allow to do that, and that's what we help.
That's a great point, that it's all really about the communication and getting everybody on the same page. And I think we just saw from the Dina video, Tim, that that's kind of what your company is all about as well.
Yeah, absolutely. And I think that when we look at New Orleans specifically as well, and why we're interested in really kind of breaking in even further into the New Orleans market, based on some demographics. From what we have found is that about 11% of the population in New Orleans are seniors, and you saw in our video that we're very focused on trying to help seniors age at home. And based on some of the data that we've seen, it's somewhere along the lines of about a third, or about 32% of those seniors are living alone in New Orleans. And so how can they actually make sure that they're being transitioned to the right care setting, and how can we help them do that? And so if for us trying to work in New Orleans, I think that we see an opportunity to help, and to be able to use our technology, is if we can work more closely with some of the health systems and plans in the area to make sure that those seniors that are living by themselves can make sure that they've got the really simple tools to be able to help them get the care that they need in the settings that they want.
Great. Well, it's great to hear that there's so many opportunities for us all to work together, from our partners who help us put on NOLAHI to the public agencies to the companies. It's amazing to look at the potential. So right now, let's take a look at a video from Predict Health. Can I move up a little? Sitting on a couch all together is the biggest story of 2020 and COVID, how it's changed all of our lives. I want to ask you all, how has it changed your business, and what steps do you make now that we're kind of over this initial, kind of almost an initial shock phase? We're over that. We all know that we're going to be living with COVID for a long time. So I'll start with you, Shub.
Great, thank you. COVID has affected obviously everything from our clients, from their patients, the end user, as well as our employees. And after the initial shock and being able to come back to normal, what we've seen is a tremendous amount of utilization that's happening in healthcare, or different types of utilization that's happening in healthcare, and how the existing tools that folks had were not designed to take certain types of behavior. This is where we actually have to go back to the basics and look at, given all our data, what we have, can we then take certain actions. The utilization of telehealth, for example, there's been an explosion in telehealth, or home care, or caring at home. How could we use our data to help our clients reach and engage individuals along those lines? The other place that we've seen a tremendous need is around redetermination, or helping people maintain access to their care programs. So either Medicaid or Medicare, if certain types of income change has been impacted, if you don't maintain a renewed care program, so there's a lower income subsidy or extra health program that's available, how do you make sure that you are filing the paperwork in time and being able to benefit from the programs that are available to you? So our ability to use data to identify who's at risk and then help them through the process, so engage them, inform them, and then help them through the process, allows us to be able to make sure that people stay not only engaged, but also have continued access and programs available to them. And that's been actually quite transformative. We've seen 13% growth in some of our clients' membership rates, as well as engagement across the board has gone up. So this has been very fruitful and effective for our organization, and really rewarding for us. Thank you.
Wow, congrats. Wow. Tim, y'all are working with senior citizens. A lot has changed in their world. What's changed in your world with COVID?
Yeah, I think there's been, just so many far-reaching impacts. It's interesting. Our original focus is definitely on helping seniors. When the pandemic hit in March, and when we were really trying to get kind of organized and wrap our brain about what was going to be happening, one of our really large home health customers came to us, the CEO, on a Sunday afternoon, and asked how we could try to help with this. And so we actually ended up developing an assessment tool that could work not just with seniors, but with anybody who's going to be, potentially impacted by COVID. Specifically with this home health organization, they wanted to make sure their employees were being screened before they were going to actually go into people's homes. And that really quickly sort of, expanded for us. So we ended up, from that Sunday afternoon conversation to a lot of other partners that started to want the same sort of technology, ended up rolling out this solution to about 30 states over the last 6 months, and have now delivered about over 2 million assessments. And so in a very quick amount of time, it sort of took a lot of the core technology that we were already working on for seniors. And now as everybody wants to make sure that they're safe either in their home or as they're about to enter somebody's home, and to ensure the safety of those people, we're able to really kind of expand our offering, and to be able to start to really really make sure that we're making a difference on a few different angles here with technology. So that's kind of broadened our scope, where it's not just seniors, but really anybody who wants to now receive healthcare at home, which is most of the country now. And so it's really kind of expanded the different sort of things that we have to offer. So it's definitely had a huge impact on our business.
Yeah, it's been really interesting to see people who may not have embraced technology as much before are now definitely doing so. Mazzy, what's the status at Pack Health, and how has anything changed in your business due to COVID?
Yeah, absolutely. I mean, as a young company, we had all of our infrastructure in the cloud, so we were able to go virtual very quickly without sort of interruption, which is something, we don't have any legacy systems that we have to carry forward. So that was a really good approach for us to support a lot of our clients. Secondarily, what we found is we were listening to members and what their needs were. So we launched a new program, a food and medicine program. We've now delivered over 1.5 million meals in 5 months to members in their home who were socially isolated, but also had chronic conditions that we were able to manage around. And then our behavioral health product around stress, anxiety, depression, along with other comorbidities, has really taken off. So we've had to hire, train, and deploy resources. We've hired 110 people in 5 months to identify them, screen them, train them, and deploy them to clients. And we continue to grow very rapidly. I think for what Tim said, everyone is, even post, vaccination and a semi-normal world, I think the consumer is going to really demand some level of service in their home and continue to be more comfortable receiving care in a home environment.
And we'll see a video from Pack Health in just a minute, but first I wanted to get to Eric. Eric, as a testing company, I'd imagine there's lots of opportunity for your company. How has COVID changed your business?
Almost completely. I mean, we've accelerated, as you can imagine, we've been able to accelerate a lot of our plans that we had in place back in 2019, strengthen many of our clinical partnerships, our customer relationships, and our community involvement. We now dedicate about 50% of our lab and personnel to COVID testing. We were tapped pretty early on to perform different blood tests, which was our bread and butter from our cancer work, of course. And we've been able to utilize our knowledge of multiplexing, which is the platform on which we built our cancer diagnostics, in order to essentially bring more clinically sensitive COVID diagnostics and earlier detection tools to this community. And in doing so, we've been able to get involved with some of the vaccine trials. And we've also been able to, as I mentioned, really get involved in some of the decentralized opportunities that are out there by sending blood collection kits that can be done at home, out into homes, and for investigational use, get all of that data put together when it hits the lab. So this has really transformed our business. It's accelerated a lot of our plans, and we're also very sensitive to many companies and families and people that have been negatively impacted. And this, I guess the silver lining is that, of course, in medical technology and in diagnostics, almost the entire world is focused on beating this pandemic. And so we're all playing our own part, and we think we are hopefully going to be able to have a much better 2021, maybe after the next 6 months or so.
It's so interesting how digital health has been kind of like a nice to have, next gen type thing to must have, we need it more, we need better solutions right now. Lots of people will say we've just, leapfrogged 5 or 10 years into technology adoption. So I think all of y'all are in a real interesting space. Let's go ahead and take a look at a video from Pack Health now.
At Pack Health, we get it. Changing health behaviors is hard. Every person has unique circumstances, needs, and goals. And the more people you're trying to change, the more difficult change becomes. Behavior change scientist Albert Bandura said it best. Humans are producers of their life circumstances, not just products of them. So, how do we help a lot of people change their health behaviors while taking their unique stories into account? That's where Pack Health comes in. Pack Health is a digital health coaching company for chronic disease management covering over 25 chronic conditions. We help individuals improve their health outcomes through person-to-person support. Our in-house health advisors are trained using behavior change science with an empathy-driven approach. Pack Health members can expect their unique story to be an elemental component of their member journey. We address comorbidities, barriers, and social determinants of health, so we're able to treat the whole person, not just their disease. Here's how it works. Members enroll in Pack Health and are matched with a personal health advisor. Members start by setting a large health goal, such as, I want to get my blood sugar under control, or I want to increase my weekly exercise. Health advisors work with members through weekly phone calls, texts, and emails to understand more about the member and help them break down their large goals into smaller goals. We're able to personalize engagement through wearable data, patient-reported outcomes, and more. Our members make real improvements in their physical, financial, and mental health in only 3 months. At Pack Health, we know it's possible to help each one of our members manage their health in a way that works best for them, and we can support your population too. Visit packhealth.com to learn how to get started.
I really like that bundling from Pack Health, mental, physical, and financial health. So often you really can't have, it's a three-legged stool. If one of those stool legs is not solid, you're going to have trouble making the other two solid. So thanks, Pack Health, for that. The final question this afternoon, NOLAHI was born out of our healthcare providers saying these are our challenges in digital health. We need some help to try to find those new ideas in new companies. And we've heard many times that it's, with the company driving the transition, the healthcare provider, it makes it a much different experience with entrepreneurs and startups. So I'll start with you, Tim. How important is it to have the healthcare providers be able to succinctly tell you, hey, this is my challenge. Can you fit this need?
Oh yeah, no, I think it's a fantastic mission that you guys have established here with this challenge. It's beyond the most valuable thing that we have. To be able to hear the pain points that our providers are having, that's our currency. That's what we need to understand to really make something happen. Our team before COVID invested a lot of time in going into the field and shadowing different providers, whether it was in a health system, whether it was in a home health organization, skilled nursing. And it's really important to have all the different types of providers, as well as their staff, tell us what they need. There's a lot of different pain points across an office. A lot of times we'll think of a physician or a nurse, which are very important actors in the healthcare arena, but then also the social workers, the case managers, the folks that are, the personal care aides that are going in and out of a home. How does everybody get impacted by different things? And really understanding their pain point helps us develop better solutions. And then it's on us as technology providers to really listen and understand how we can apply our skills as technologists to the problems that we're hearing. But being able to get very clear pain statements from these different providers is invaluable to us.
Shub, is that the case at Predict Health? Shub, I think you're muted, so we'll get back to you in just a second. Or you hear me?
I do hear you. Sorry about
that. There you go. All right, we hear you.
Yeah. So just to absolutely, I would absolutely concur with the point you made, and understanding the pain point from the providers and their staff to the organization. But there is one caveat to it, because we work in an ecosystem, so you need to understand what the pain point from the provider side. You need to be able to also understand how that pain point manifests itself on the payer side. So ultimately, you have to have the payer perspective, and then on the consumer side, the patient side. So you need all three, an understanding of taking that pain point and really putting it in context, or you can act on it. Because if one by itself you cannot solve the whole problem by just looking at one problem. And I think this is reflective of which we love the program at NOLAHI, is you have your sponsors reflect that. You have big ones on the provider side, you have the payers involved, and you're bringing in perspective from the patient, the consumers, as well as the innovators. So you need those three to really come together, and that's where you will really be able to make a big difference.
And Mazzy, at Pack Health, your challenge was sponsored and authored by New Orleans East Hospital, but also the City of New Orleans Health Department. Have you guys worked with other public health agencies, and how important is it to have their say?
Yeah, we have. And the general theme that we hear from a lot of partners is the 6,000 hour problem. So I may see the member, the patient, 1 hour a year, but I don't know what happens for the 5,999 hours that I don't see them, and what choices, what challenges, what barriers. And that's really what what constituted our development of PAC Health, was how do we fill the 5,999 hours that members are out there making choices, having other pressures on them, and how do we become the eyes, ears, and coach, and sort of the navigator for those members, and really bring them back into the health system as needed or at the appropriate time. Because of the fragmentation we have in healthcare, that can be very difficult for a person who's overwhelmed with chronic conditions to deal with. But that was the general theme that we've constantly heard, is the help me solve the 6,000 hour problem.
And Mazzy, we just got a viewer question in the chat window to PAC Health. Is a digital divide a barrier in social determinants of health in some of the patient segments you serve? I'd imagine yes, but I'd imagine it varies.
It does vary. So we actually have members across the board in 20% of our members in rural areas. But we have, we serve dual eligibles, Medicaid, Medicare Advantage, commercial members. And the majority of times, texting and phone calls seem to be the key to the kingdom when it comes to engagement, especially on the texting side. With certainly there are some populations that are in even more remote areas that we have yet to find approaches that would work. But we also do snail mail in certain cases for members, or engage their caregiver beyond just the member.
Great. And Eric, at EDP, with all the testing that you all do, I'd imagine you hear a lot from your customers. How important is that?
Oh, extremely important. And, when our company first started its life, we were focused primarily on gastroenterologists and what tools did they need in the surgery center. And what we were missing was the input from the primary care physicians. And when we went out and started surveying them, we were hearing, especially in some of the rural populations, just, horror stories where they could not even screen patients for cancer because there was no ability to pay for follow-ups and pay for confirmatory testing and things like that. And, that's just not how healthcare should work in the most developed country in the world. And we thought that was awful. So we really shifted focus to try to bring better tools to the primary care setting, those first contacts with the patient. And then similarly, when COVID first hit, we were on the phone with all of the local medical centers and hospitals, and we really listened to them. And they said, we do a lot of our molecular testing through the big reference labs, but there is no solution locally for serology. And of course, we were blood testing experts. We think we are, at least. And so we really dove into that field, which got us one of the first of a dozen listings on the FDA website. We were one of the first listed in April for serology testing. And then we got involved recently in some of these vaccine studies to determine a patient's immune response, when they were inoculated. So these are things that, opportunities we would never have found if we didn't go out and survey the customers and really start to look at the input from the healthcare providers themselves.
2020 is all about change and listening. Thank you, Eric. And we do have a video from EDP to take a look at as we wrap up this segment of NOLAHI.
Hi, I'm Eric Mayer, CEO of EDP Biotech in Knoxville, Tennessee. Our name stands for Early Detection Products, and we are traditionally a colorectal cancer blood testing company. During this coronavirus outbreak and pandemic, we are repurposing our equipment and using our staff and expertise to address blood testing for antibodies in the general population in eastern Tennessee and actually throughout the state. We plan to not only provide antibody testing to citizens here to help combat the virus, we also plan to invent and develop new diagnostics which will hopefully prove to find these infections earlier. With the use of funds, we plan to ramp up R&D and staff up and hire people here in Knoxville to assist us on this mission. Thank you for your consideration.
Well, I want to thank all of our panelists this afternoon and definitely congratulate them on winning parts of their NOLAHI challenges. I'll go through those for us all just before we end today. The HCA Tulane Healthcare Transition of Care Challenge, that's Tim Coulter from DINA. The Ochsner Lafayette General Healthcare Consumer Engagement Challenge, that is Predict Health, Shebdas Gupta. Maisie Rosalina represents PAC Health. They are the winner of the New Orleans Health Department and New Orleans East Hospital Diabetes Management Challenge. And EDP Biotech is the winner of the Tulane University Ujima Economic Development I Deserve It Challenge, and Eric Meyer joins us from EDP. Thank you all so much for joining us this afternoon. Have a great afternoon. We hope to see you in person in New Orleans soon. And for everybody watching at home, NOLAHI continues in just a few moments. We will have the Bio District virtual site tour. Please stick around and join us. We'll be right back.
get you in.
Okay. Hello, everybody. I'm Louis David from the New Orleans Business Alliance. Welcome to our BioDistrict virtual site tour. This is a continuation of our New Orleans Health Innovators Challenge programming this week and earlier today. And I'd like to say a special hi to all of the folks who have joined us maybe just for this site tour. So we're real excited to have you with us. This is our third virtual site tour. Like everybody else, we kind of moved things online over the past couple months. So we've been able to be with you to take a look at some of the sites in New Orleans specifically designed for food manufacturing. We've done one tour just focused on international companies interested in New Orleans. And now we're excited to talk to you about some of the real estate opportunities in the BioDistrict. So we thank you so much for joining, and we will have a very interesting discussion with a lot of updates for some really big projects in the BioDistrict. So thanks for being with us, and we'll go ahead and get started and take a look at the agenda for this afternoon's BioDistrict virtual site tour. So we'll do a quick background on the New Orleans BioDistrict. We'll also talk about some of the opportunity zones that are in the New Orleans BioDistrict and how that may be able to help any new or existing businesses. We'll also take a look at what are, I think, the biggest, most important parts of the BioDistrict, and that's the anchors. You'll get to meet the neighbors, see some of the institutions that really make it the center of bio research, basically for the Gulf Coast, definitely for New Orleans and Louisiana. We will also talk about some of the newest construction and some of the new developments in the BioDistrict. If you go out and go through the district today, you'll see construction going on, and we've also had some announcements as recent as last week about some of the projects that are coming soon to the BioDistrict. And then we will have discussions with two people who have very deep knowledge of the BioDistrict. Paul Richard is from Ladder and Bloom. He will join us to talk about what he sees as the best and highest use of land in the BioDistrict, and also some of the history of why the BioDistrict is here, how it got here, and what he sees over the next few years as the biggest opportunities there. And then we'll also talk to Joseph St. Martin, who is from 1532 Two-Lane Partners. They are the group that is currently redeveloping the charity facility, the old charity facility, which is kind of in the heart of the downtown side of the BioDistrict. You know, it's about 1 million square foot project, $300 million project, probably end up being worth a lot more than that by the time they're finished. But they're making real progress on that project as we speak. So that'll be great to have that intro. And then we will also have a site tour of a number of sites that we think are primed for development, both for sale, for lease, small, big, lab, office, even some mixed-use hotel sites that we think have a lot of opportunity in the BioDistrict. We're also going to ask for your question and answers throughout this entire presentation, so please submit a question in the chat window on Slido if you want to know specifically about something, and we will have the opportunity to answer those questions throughout the hour. And once again, if you're watching this and you're like, wow, I have colleagues who really should be watching this, don't worry, we'll have it up on the NOLAHI YouTube channel sometime in the next few days. We really want these virtual site tours to be a resource that can live on past the actual event. So let's get started. Let's take a look at a map of the BioDistrict. So as you can see here, the BioDistrict is about 1,200 acres, really in the center of New Orleans. The district was established by the Louisiana legislature in 2005, and you know, from its further closest river portions, it touches Tulane Medical Center, Canal Street, the Superdome, the New Orleans Arena. It has fantastic access with Pontchartrain Expressway and I-10, and really the foot of the Crescent City connection going through the BioDistrict. And it extends all the way up through the medical center campuses along Canal Street up to Xavier University, which is a huge anchor of the BioDistrict. So it really encompasses lots of opportunities for, you know, office, obviously, medical space, obviously, but also some industrial possibilities, some live-work possibilities. And I think everybody agrees it'd be real tough to get a more central location, not only in the city of New Orleans, but really in the New Orleans region and in the entire, South Shore and Gulf Coast region than the Biodistrict. So it's really varied, and it's got lots of different opportunities, which we hope to show you this afternoon. Taking a look at the next slide, as you can see, everything in pink is an opportunity zone. So opportunity zones were created in 2017 by the federal government to really direct targeted investment into cities and states. These zones were created by the Louisiana Governor's Office, as well as they solicited input from lots of different local agencies, local lawmakers. They looked at what the possibilities were across the city, and much of the biodistrict sits in an opportunity zone. Now, what does that mean for businesses? It offers tax incentives for investors. Those kind of projects can be construction, commercial real estate development. That can also apply to development and renovation of existing properties. But there's a second side to opportunity zones, and that applies to creation of new business and further investment in existing businesses. So we already have some opportunity zone projects that are underway in the biodistrict. So this is just another incentive to do business and to take a second, third, fourth look at projects that are in the biodistrict. Taking a look at the next slide, I mean, this is why the biodistrict exists. If you look at all the names on this slide, from the medical providers to the learning institutions to the incubators and research collaboration organizations, it's really rare to have this variety of institution just a couple of blocks away from each other. And we all, everybody watching this from New Orleans knows New Orleans is a really big, small town. And to have that proximity and to be able to have Tulane across the street from LSU and UMC across the street from the VA hospital, that proximity and that power of place is really possible in the biodistrict, and we think that's one of the most unique things about the biodistrict in downtown New Orleans. So University Medical Center is the LCMC operated LSU teaching hospital. That's a brand new billion-dollar facility on Canal Street. Its next door neighbor is the VA Medical Center, also a brand new billion-dollar facility. The VA, that's their largest institution in between San Antonio and Atlanta, just offering all kinds of specialized care for people throughout the region, both the general public and the veterans community. So that just opens up so much research opportunities right there. But then we do have our educational institutions, which are in the biodistrict. So you've got Delgado operating the School of Nursing. LSU, of course, their main campus is in Baton Rouge, but LSU Health is headquartered here in New Orleans. All of the doctors trained in South Louisiana through the LSU system are physically in the biodistrict, and they've got some exciting improvements coming to their campus, as well as Tulane University. They're training their doctors and their medical professionals here in the biodistrict, and they're operating their own medical center, that's Tulane Medical Center, through participation and cooperation with HCA Healthcare. They were one of the sponsors of one of the NOLAHI challenges that we talked about earlier. And then you look at Xavier University, which is running the South Louisiana's pharmacy program. They're also contributing they produce one of the highest numbers of black med students in any university in the country. So if you just look at the breadth of those educational institutions, from the community college system to our flagship public university to top-tier private university and top-tier HBCU, we've got all those folks within this geographical area, which is a really special thing. And then kind of the final tier of our institutions that make this such a special place for innovation, the Bioinnovation Center, which is our incubator, as well as Louisiana Cancer Research Center, which is here to make sure all of the research that's going on with all of these entities is really collaborational, is really helping. It's with the health outcomes as the final step, as well as business development for both of those entities. You know, they're there to make sure that the research going on at the educational institutes is captured and can help health outcomes and can also help our economy. So I did want to put on here the purpose of the biodistrict. This is from the legislation that created the biodistrict in 2005. The biodistrict New Orleans is a state-enabled economic development district with taxing and bonding authority that is charged with the responsibility of growing both the programmatic and physical development components of the biosciences sector of the New Orleans economy. We are very excited at NOLAHI to work hand in hand with the Biodistrict Board to make sure that they are taking the steps that they need as far as programming, as far as funding, and we're really excited to be able to partner with them and help market the Biodistrict, not only to New Orleans and the region, but really to the world. So I really, I was ahead of myself. I do want to show off some of the construction projects that we have that are either recently completed or have been even recently announced in the biodistrict. About $350 million of construction projects, and these are all within the district's boundaries. LSU Health just last week announced that they are building a $100 million housing development for their med students right behind med school. So their students will be able to live and work, and as you see from the pool there, play a little bit, all within a couple of blocks of each other in the biodistrict. That's their first new housing development for the LSU New Orleans campus in more than 50 years. So that shows their investment and their belief that this part of the city will continue to be an anchor of healthcare development in New Orleans and in Louisiana, really. Tulane is also investing through a renovation of the Warwick Hotel with private developers. That's a $100 million project for housing for their med school students. That's really going to be a real visual anchor. That's the hotel that's been out of service for a number of years, right on Loyola, across Duncan Plaza from City Hall. So it's a real prominent location. So it's going to be awesome to have that facility back in use. And that project was just announced a few months ago. UMC has run out of parking spaces. That's a good problem to have between people working at the facility, patients, people coming to see the facility and see patients in the facility. So they've just broken ground on a brand new parking garage next to the current parking garage on Tulane Avenue. And Canal Crossing, that's you know, an $85 million private housing development on Canal Street. Literally, you know, a block or two within the beginning of the biodistrict, but that shows that there's also private dollars flowing into the biodistrict, and that you know, private developers see a need and see a housing need for folks who are working, going to all of these institutions. So now I get the pleasure of introducing our first guest this afternoon. Paul Richard with Ladder and Bloom has been involved in the biodistrict for many years and has a rather encyclopedic knowledge of why it exists and why we're working so hard to let everybody know about it and why we're marketing it. And Paul, welcome this afternoon. And can you talk a little bit about how you got involved with the biodistrict?
Well, when the biodistrict was first created, when the board was actually impaneled back in the early 2000s, we recognized, Ladder and Bloom, of course, recognized that the biomedical industry was an emerging industry. And they had just finished the master plan for the entire district. They had looked at, you know, the growth, the rate of growth in the healthcare industry, and sort of did a mapping, if you will, of the entire district in terms of the quadrants of development, what they had targeted here, what they had targeted there, and then essentially just started tracking it because clearly that was going to be a tremendous opportunity, not only for the real estate business, but for the city of New Orleans. So I just maintained an interest and have been essentially attending most of the biomedical district board meetings just to keep plugged in. The world is changing so fast with digital health, telemedicine. I mean, the demand, I think, is going to be ferocious. I might add, first off, I wanted to say, for those of you who are not from New Orleans, I want to give you a warm New Orleans welcome. And for those of you who are in New Orleans, I hope today, what we talk about today will sort of open, at least create a level of awareness that you did not have before about the opportunities of the biomedical district.
Paul, I want to thank you for your leadership on the private side in the real estate community of pushing the importance of the bio district. You're one of its biggest cheerleaders. How do you see the bio district in the next 5-10 years? And I understand your answer to that question is probably different than what you saw a year ago. And I think you might be muted, Paul. Paul, you hear me? I think you're muted.
We can go to Joe with audio.
You hear me, Paul? You were muted for a second. I think we may have lost Paul. So we will go on to our next guest and try to bring Paul back later in the biodistrict tour. I'd like to introduce our next guest, who is really at the helm of one of the largest projects to ever be even proposed in the biodistrict, definitely the largest project underway in the biodistrict. That is Joseph St. Martin from 1532 Tulane Partners, which is the group working on the redevelopment of Charity Medical Center. So Joseph, I really appreciate you being with us today. How are you? Joseph will be joining us audio only with some technical issues this afternoon. And Joe just dropped out as well. So we will get back to both of our guests in just a moment. Good thing we have some other things planned for you, for everybody who's watching. I'd like to go through some of the sites that we have identified as really kind of high opportunity sites, and we'll get Paul and Joe to weigh in on some of these sites if they're able to join us a little bit later. But one of the first sites that I wanted to highlight is actually where the VA was doing a lot of work while they were waiting on their new facility on Canal Street to be finished. So the former VA facility at 2237 Poydras, it's on what we call Upper Poydras, so it's across I-10 from the Superdome, which is more of an industrial area, which gives you lots of flexibility. So this building was constructed as a temporary VA hospital, like I said, while they were working on the move from closer to City Hall to their new facility next to UMC on Canal Street. It could really be a unique medical lab research center. It could also be medical office. So you've got lots of opportunities there, and it's got tons of parking, which anybody actually in New Orleans who is familiar with that area, we just talked about how UMC is building a new parking garage. They've got 100 parking spots at this facility. So it's recent construction. It's got a lot of possibilities. This was actually the surgery center for the VA while they were waiting on their new facility. Lots of redevelopment opportunities, or it could be something that someone walks straight into and says, this could be a great clinic or a great research lab, something like that. This is a site that is for sale. McHenry Company is a broker. Mimi and Park are really interested to hear what could be possibilities at this site. So please let them know if you're interested. Also, you got great visibility from Poydras, and you have some options to get some visibility from I-10. So you can really see the Superdome from this facility, which is unique. So that's why I like this facility. Let's take a look at 601 South Galvez, which is just next door. That's a huge, currently it's a warehouse. It's got excellent redevelopment potential. You can see it from I-10, 80,000 square feet under roof. Currently, a number of uses. Part of this facility was actually a former Times-Picayune distribution facility. So it's got some of the loading docks, if that's what you want to use it for currently. But it's also, it's got that location, as you can see on the map. It's 2 blocks away from UMC and the VA's new campuses. So it really has a lot of opportunity. It's on a corner. Like I said, you've got some visibility from I-10, 80,000 square feet, and Corporate Realty is working on this property. So please give them a call if you have any interest in that. Paul will come back in a little bit to talk about 2025 Canal Street. He's got some inside info on that property. But this is a mid-century modern office redevelopment opportunity, really kind of a blank slate across the street, across Canal Street from the new VA facility. So I could really see this as, you know, medical office, or also some lab space. This could be really cool startup or kind of graduation space for biotech, younger biotech firms, to have that immediate access to the medical centers, but also to be able to have really a cool, bespoke, customized office space. This site includes a parking deck, so that's always important, especially in that area with so many people now flocking to that area for medical care and for office reasons. And also you've got great visibility on Canal Street, you know, one of the premier addresses in New Orleans. There's also some additional adjacent property available next to 2025 Canal Street. Let's take a look at our next property. That would be, we'll go back, 2537 Tulane Avenue. So this is a unique property. It's also at the corner of Tulane and Rocheblave, directly across the side street from the back of the VA facility. The picture you see here is a potential idea for hotel. This site is owned by the File Organization, which folks in New Orleans know is a long-term investor in New Orleans real estate, in some prime New Orleans area real estate, including Lakeside Mall and some other developments. So they're really interested in a high-quality, long-term development at this site. They're open to lab, office, mixed use, residential, hotel. You know, at the beginning of the bio district, long-term extended stay hotel was something that was bandied about a lot. There's still opportunity in the bio district for that type of project. So this is a really interesting and unique clear site opportunity. Also, as a startup, if you just need like 1,000, 2,000 square feet, we've got that in the bio district too. So the Campus Federal Credit Union facility was built about 5 years ago, completed right around the same time as UMC and VA, and they have a number of small office suites there that would be perfect for someone who's partnering with any of those institutions on research, or if you're starting up and you need a business development office, but you need that proximity to the medical facilities, especially it's, you know, 4 blocks from LSU's med school. So, you know, we just kind of wanted to show that there's a large variety of properties that are on the market in the bio district. And this is a really unique and cool space. I've been in this space before. It's on the 3rd floor of the Pythian Market. So, you know, Loyola Avenue is a boundary of the bio district. And this is, once again, got some flexible, smaller suites for startups, offices, somebody who's doing their research at Bio Innovation Center, or working closely with one of the universities. This would be an ideal spot. It's in a mixed-use building, so you've got apartments above, you've got an awesome food court below, which, you know, these days when we're all watching where we're going and trying to limit limit our exposure to the outside world, this is a really unique opportunity for the right tenant, especially if you want to stay inside all day, although today is gorgeous in New Orleans, so everybody wants to stay outside today. But that's directly across the street from the Tulane Medical Center, as well as the Warwick Hotel that we talked about a moment ago that's being redeveloped, and Duncan Plaza. So these are just some of the sites that I think are unique, I think have a lot of opportunity, that are available today. And if you're interested in any of them, please reach out to the brokers. Please feel free to reach out to me at NOLA BA, and we can get you in touch with the folks who can give you more information on that, and also set up tours. You know, we can go look at places, give you a feel for the neighborhood. So those are some of the spots that we think have great potential. And we do have Jose Martin from 1532 Tulane Partners, who's able to join us now on the phone. Joe, do you hear me?
Yes. Good afternoon. I can hear you.
Awesome, Joe. It's great for you to be able to join us. I would love for you to give us an overview of what's going on at the charity site right now. I think a lot of people in New Orleans don't realize all of the work that you are doing at this moment. And I think people don't realize how quickly that's going to become, once again, a part of our lives and back into commerce.
Yes, well, things are moving at a very fast pace. As you're aware, we were awarded the procurement from the state of Louisiana back in February of 2009. Believe it or not, post-COVID has hampered our plans somewhat, but not too much of an issue, given that we were primarily design phase of the project when the COVID epidemic hit. So a lot of our design team were both working locally as well as out of state. We have a national architectural firm, BNIM, that's supporting our wonderful architecture team, Williams Architects. And all of our consultants are actually local engineering firms as well. So for the last probably 14 diligently been working on the finalizing of the abatement and renovation plans. A very large component of the project is storage, and for those of you who are familiar with them, Charity was built in 1934 and actually sits on a National Historic Registry. So we took that as an opportunity to pay homage to the historic roots and nature of the university. Most people don't realize that Charity, post-Hurricane Katrina, was actually from providing any medical uses. That was one of the caveats when they received the state received the money from the federal government, is that use could not go back into its prior existence. So what we creatively worked to try and do is, since Charity couldn't go back in its primary medical function, we wanted to try and mimic and replicate as much of the community aspects of what Charity offered before, being that Charity was primarily a medical teaching institution. So as we approached our programmatic approach to the project, what we did is we looked at tenants that could fit that mold. So 3 of our primary tenants that are going back into the building are exactly that mold. They're teaching entities, with the first being Tulane University, which is taking about 1/3 of the building. And ironically, they're going to be occupying the original wing that they occupied in 1934. Most people don't realize that Charity was actually split half of the day by Tulane and half by LSU. And Tulane's wing represented the East Wing. And we've been fortunate enough to have them come into. They're right now at about 330,000 square feet of occupied space that they're coming into. And then secondly, we're bringing in a 8th through 12th grade charter school system. The school program actually was the recipient of a $10 million bill in the Melinda Gates Foundation. So we're excited about having them in as well. And then lastly, we're providing what's called an early learning center that will provide health and education opportunities for children as young as 6 weeks old up to 5. So we wanted to rebrand and rebirth that aspect of charity being a true community center. So where you have opportunities from as young as 6 weeks old to, until life moves us on. So we're really excited. There's a lot of opportunity coming from a staging standpoint. Now that the design documents are complete, we'll be seeing the interior abatement scopes of work starting, which is basically coming in and taking out the old mechanical, electrical, and plumbing system. All of that will be rebrand new. And then obviously the program will come back with Tulane University having classroom and maybe some laboratory space. And then we have the high school and early learning center. And then we've got about 300 apartments that will be designated as workforce housing apartments. We understand the need for workforce housing in the New Orleans market, so we're very sensitive to that and are making that a primary component of our retail component.
That's exciting. It's awesome that it's going to once again be a teaching facility, and it's so important in its location in the biodistrict, and will really drive a lot of traffic in the biodistrict. Foot traffic, people coming and going, retail. Once we're able to do those things more easily. Joe, what's the timeline?
Timeline: we're looking by early February of 2021. For the abatement scopes to start, and that will be anywhere from an 8 to 12 month period. And then we're going to have the actual renovation work kind of overlap starting 4 to 6 months into that. That's the overall goal of being finished by kind of mid to early April of 2024.
2024, okay. But we'll start to see some real progress early next year.
Oh yeah, early next year you'll definitely be seeing some project progress, and one of the first things you'll see is we're in a process of installing what's called a construction buck hoist. And if you're familiar with downtown New Orleans, it's similar to what's at the foot of Four Seasons. It's basically an exterior construction elevator. So that will probably be starting in the next 30 to 45 days.
Awesome. Great. Well, I appreciate you joining us. Do you mind sticking around? We're going to do some question and answers a little bit after we talk to Paul.
Sure, no problem.
Thank you. Thank you. And so we do have our second guest, Paul Richard from Ladder and Bloom. Wow, what a cool view. I like that, Paul. It's almost like we're watching you through like security cameras. Thanks for working out some of the tech hiccups.
Is it pretty blurry?
Yep. I see you, and we're on. Can I ask you? This is what I was asking you before we got interrupted. Where do you see the biodistrict as a whole over the next 5 to 10 years?
Well, it's funny you say that. I looked at the study that was done by AECOM, which was formerly ERA, back in 2010. And they looked at 3 medical districts that compared the biomedical district to the Illinois Medical District in Chicago, the Memphis Medical Center in Memphis, and the University of Alabama at Birmingham Medical District. And they did an assessment of what occurred, what was built, and then what was the secondary construction that occurred as a result of those hospitals anchoring those districts. AECOM did an extrapolation and did an overlay for the biomedical district in New Orleans. And interestingly enough, they did a 5, 10, and 20-year projection. And over a 5-year period, and this is back in 2010, they indicated that there could potentially be 6 million square feet of space that would be built. And that's all forms. That's office, retail, medical, institutional, public. In 10 years, it would be 10 and a half. In 20 years, it would be about 13 million square feet of space. So when you look today and where we are today, we're really not that far off from the first 5-year projection, because we have to keep in mind 2008 was the financial crisis, and when you look from there and there forward, you would see that there is some considerable development. And if you just add what LSU is doing with their 550-unit apartment complex, the historic rehab and opportunity zone project that is the Warwick Hotel, which will be $2 million. The new UMC parking garage, Canal Crossing, which is 550 units of luxury apartments. That in itself is about $600 million worth of development. And if you add the 2 hospitals, since 2010, you really have had roughly $3.6 to $4 billion worth of development in the biomedical district. So that's considerable. What most people don't understand about the biomedical district is that, and you showed it in the map earlier, almost all of the biomedical district is an opportunity zone. And within the biomedical district, there is a sub-district called the innovation district, which is essentially the area from City Hall to the old VA complex in that quadrant. And that's going to become a TIF also. So you now have in place multiple incentives when you add all the things that the city could offer in terms of TIF and pilots and things like that. When you mix or match that with the opportunity zones, what you can do with opportunity zones, you really have a baseline for a very robust development opportunity in the biomedical district. And secondarily, and I think this is a key point, you called them the anchors earlier. It's the potential connectivity between the existing anchors and stakeholders within the district that to date I don't think has been maximally leveraged. So what I mean is, and you didn't I mentioned it earlier, but you have to include the City Hall complex as part of that. The City Hall, the Civil District Court building, when you add the UMC, VA, the various universities, the biomedical district, and the LCRC, the Louisiana Cancer Research Center, you have an enormous opportunity for cross-pollination and community to occur. And I think we're just beginning to see that sort of thing, because I think for the first time in a long time, we're starting to see P3, public-private partnership type of transactions that are occurring. The garage at UMC, the apartment complex at LSU, those are all P3s. So I think the marketplace here in New Orleans is beginning to understand what that could mean for underwriting development. As it's my mantra: if you can't fund it, you can't build it. And I think what we're seeing now is a great deal, not only in terms of sophistication, but awareness that this has to, from this point forward, most of these projects are going to have to be leveraged with public dollars.
Yeah.
P3, that sort of thing. So that where I see the district going is as the hospitals begin to the expansion, and you can see it's already. I mean, if you're running out of parking, that certainly is an indicator that it's something well is happening in the hospitals. So I think you're going to see robust development here in the next 5 to 10 years.
Yeah, that was kind of my next question for you. What kind of specific real estate development deals do you see over the next 5 years?
Next 5 years? Well, I think initially what we're going to see is development deals that service the capital needs of the institutional stakeholders in the district. So that would be the universities and things like that. What has been missing, we have not seen any hotel development. We have seen very little retail development. And when I say retail, what I really mean is neighborhood services. If you've got 3,000 or 4,000 people coming into the hospital every day, they have to eat, they have to shop, they have to do laundry, that sort of thing. Probably the biggest challenge, Louis, in the biomedical district is Canal Street. The length of Canal Street from essentially Loyola to North Russia Blade, which is the edge of the district, is populated by multiple historic structures. I mean, there is not really one square of ground between those 2 points that do not have historic structures associated with it. 208 Avenue is a little bit different. You have some parcels, the file parcel, that we could create some massing and some height. The Canal Street is, there is some limitation in terms of that's as a result of the historic district. You have to build with scale, that sort of thing. So I think the investment community is beginning to understand what's possible given the land that's available. And I think you showed all of the properties that you went through the list of properties that you had in your presentation. I missed that, of course.
Yeah. Let me see if I can pull the 2025 Canal Street property up, because I know you had some. Yeah, there we go. I know you had some interesting insights into this property. Tell us a little bit. We had a discussion earlier this week, and you were like, "I really think this is a unique property. We should highlight it." What's your take on why it's unique?
The thing about this property is that it has not been developed since Katrina. So when you go to the inside of the building, it's still in its pristine Katrina damage condition. But it was a medical building prior to the Katrina. It was a full medical building. It's 3 stories, about 45,000 square feet. That has something very unusual in that it has an adjacent 200 plus parking deck, which is something that is in any city now. Parking is in such great demand. So that is in an opportunity zone. It will be declared historic as a mid-century modern office. They're working through that process today. I'm just using that as an example of an opportunity that still exists, and it is located right across the street from the University Medical Center. So that's an interesting opportunity. Well, it's one of the things I wanted to say is that, and I wanted to say it in the beginning and I forgot. When I look at the real estate, particularly to your audience today, I wanted to look at it through 2 lenses. One, as a user, I need space because I'm developing something, or I'm making something, or I'm manufacturing something. That's one thing. And then you have the investor developer who's looking for opportunities to buy, rehab, reposition real estate to service the user. So when you look at, from a user standpoint, I just want to let the folks in the audience know that there is considerable office space within the district that is available now. And most of that's going to be across the street from the Dome in the 2 office buildings that are right across on either side of DMC. Now, keep in mind that DMC that's digital, it's all digital. And one of the biggest trends really in medical today is AI, artificial intelligence, of course, and the use of VR and AR in health. And as you know, VA, as well as LED, digital has been one of the key and primary pushes, I guess you could say, in the state of Louisiana as well as the city of New Orleans. So I think you're going to see a convergence or an intersect between the growth of the digital industry here in New Orleans and the growth of digital health in New Orleans. So when you add those 2 components to what is already available and what we see happening in the biomedical district, again, as I hate to repeat myself, but I think this it creates a huge baseline for robust.
It's really interesting to see that much opportunity in a medical district in a city our size, as vibrant as New Orleans, with so much new infrastructure. Paul, I appreciate you joining us, and I appreciate you switching locations for us. I love this view. And I wanted to ask one more question from...
I apologize for that.
No worries. Oh, and we've got Jose Martin on video. Awesome. You guys know how to round this out. Joe, I wanted to ask you one last question. What does your group hope that the charity project spurs through the neighborhood? It's going to be a big deal when you open 2024. There's a lot of time between now and then. What do you hope? What kind of changes do you hope to see in the biodistrict?
Well, you mentioned early on in the conversation the word catalyst. That's a term that we've repeatedly used throughout our design, our construction, just overall day-to-day project terminology, is that we really want this 1 million square foot structure to really serve as a catalyst. Since post-Katrina, the amount of foot activity that used to travel up and down Tulane Avenue along Claiborne Avenue, until there was a football game on a Sunday, there really wasn't that much activity area. So we really want this project to serve as that catalyst to not only just spur that one spine right at Tulane and LaSalle, but there are 9 other buildings that are part of the LSU's campus that are still dormant. So the revitalization of charity is just the kicking point of creating an opportunity of creating a district where you can connect the Superdome. You talked about Duncan Plaza, City Hall, the VA hospital. Charity sits right in that footprint. You can literally have a connection from the Superdome to the French Quarter, and you can have a connection from City Hall all the way down past through where the new UMC and VA Medical Hospital Center sit. So truly, this can become a vibrant, pedestrian-oriented neighborhood, which again is the whole purpose of what Opportunity Zone projects and zones are set up for, to take those distressed communities and distressed areas and revitalize them and bring their economic impact back into those areas of the city. And I truly see this as a great opportunity to bring a strong economic impact back to downtown New Orleans.
Definitely. And, your neighbors right next door are the old VA facility as well as City Hall. Lots of talk about what we do to move forward with those projects and what the next steps for those sites will be. So a lot of really interesting stuff coming down the pike. Well, I want to thank both of you so much for joining us. You got something to say, Paul, real quick?
Yeah, just a small comment to Joe's point. It probably should be mentioned. Yes, LSU has those 9 buildings, but the DDB has just finished their study last year in terms of the extension of the Duncan Plaza and perhaps maybe either the elimination of a portion of the old VA medical complex to create that kind of nexus that would create a center, essentially a new town center in that part of New Orleans. So the Charity Hospital project, well, yes, it's a catalyst. It is more the most transformative project that will hit the city of New Orleans in a long time.
It's going to be exciting to see the construction on all sides. Thank you, Paul. Thank you, Joe. Thank you so much for joining us. I want to thank everybody else who is watching this afternoon. Thank you for joining us. If you have any questions about the biodistrict in general, any of the sites you've seen, if you want to get in touch with Paul or Joe, please email me. It's ldavid@nolaba.org. Also, my email's up on nolaba.org, so if you forget how to spell my last name. It's up there. But thank you so much for joining us this afternoon. This virtual site tour series will continue. This specific presentation will be live on NOLA BA's YouTube and other social channels in the coming days. We will also continue tomorrow with our NOLAHI programming. It kicks off its second day. We will have the pitch competition. We'll have the winner of the main NOLAHI challenge. So it's really exciting to see all of the activity that's happening in New Orleans, both on the business side, on the real estate side, throughout the bio district, and really throughout the city as we start to figure out it's more pressing than ever that we figure out how to be a healthier community. And we've got a lot of folks working on that. So thanks so much for joining us. We'll be back tomorrow, but first we want to leave you with a special video about why economic development in NOLA BA is important to New Orleans.
Economic development is possibility.
Economic development is jobs, but also opportunity.
Economic development is innovation.
It's really about individuals being allowed to fulfill their human potential.
Economic development means new products on the shelves.
Businesses supporting each other.
A bridge to equity and inclusion.
Economic development is a small business success story from the Lower 9.
Finding a way for your community to thrive.
Economic development means families can realize all their financial goals right here in New Orleans.
It's really the essential thing to keep things going. To me, economic development is relief.